thinking. You call it negotiating. You find out, do I need to do this test? Do I have not to do it? So you move beyond that. Then, of course, it is, I've mentioned, it's a protein that is produced just to enhance the seminal activities. But it's also a trace of it. Primarily, the whole thing is right inside the prostate. But there's a trickle of it that comes into the bloodstream, and that is what it is tested. And that's why the value is a bit low. But the fact that we know is that the value also varies, which we are going to look at. So it is that little trace of it in the blood that is being projected, and that is the fourth. Then the fifth one is sexual activities. For every sexual activity you have today, your PSA level will increase transiently for about 24 hours. So if it's taken immediately after I've had a lot of job somewhere, and you are now coming to, your PSA will be a little bit high. Then, of course, another thing again is recent medical procedures. You went to the hospital, and somebody decided to do what they call, rectal examination. He dips his hand right inside your rectum, probably to see something there. It will make the prostate to start releasing that into the system. Or somebody who is on a urinary catheter, he couldn't pass urine, they now put the catheter there. So long as that catheter is there, it will be irritating that prostate, and that prostate will keep producing the PSA. So the level will increase. Then another has to do with laboratory variation. This is a very interesting thing. Just about 2 weeks ago, an ex-boy called me from Federal Medical Center, Kefi, and he said, okay, he said, my PSA is very high. So I said, what is it? He said 67. When he said 67, I said, okay, no problem. Why are you? Well, he's somewhere around Koi. And I said, please, can you come to Abuja? By the time we did it in Abuja, it was 9. So you can imagine if that person had, because they had already told him that the follow-up now is for them to do what they call a biopsy for him. That's a surgery. Or he should go for MRI, which is about 200,000 or thereabout. And this is somebody who could not afford such amount. So by the time he came here and it was repeated, what did you get? We got 9. There was another patient who came to DHQ Medical Center, where I normally consult, and it was done for him there. It was 28. But the person felt uncomfortable. Along the line, being an engineer, he traveled to US, only for him to call me back to tell me that they told him that his PSA is 7. So you can see the variability when it comes to the laboratory system, because that's who we got the validity of the equipment, or even the individual who is testing it. These are things that can make the PSA to go. So the point to note here is that cancer is not the only cause of raised PSA. Let us have that. 2, several ordinary non-cancerous factors, which I had mentioned earlier, can push a prostate antigen reading up. Then thirdly, recent ejaculation may cause temporary increase in prostate. So you can see that if you look at all this, the question now is, if your PSA rises, must you be worried and start thinking of any intervention? I just brought this out to show us some signs and symptoms of prostate disease. I don't call it prostate cancer because all these ones I've mentioned, the inflammation, the BPH, that's hyperplasia, and cancer, they are all diseases. So what are those signs and symptoms that will make somebody to feel uncomfortable? 1, weak stream. In those days, when we were young, you can easily raise your penis, and when you pass urine, it will touch the ceiling very easily. But as age advances, you cannot even, when you are passing this, you have to strain a bit for it to come out. Why? Because the prostate is already encroaching on that tract where the urine is coming from. So you have that. Then urgency simply means that if you go to pass urine now, you won't be able to pass all. So immediately after you come back, after 15 minutes, your bladder will start telling you you have to go back. And when you go back, you go to very little point. So that urgency is there. Then, of course, training, that's on this side. Pain and discomfort. It gets to the point that it becomes so much that even when you ejaculate during sexual intercourse, you feel some pain. What is coming out looks a bit hot in you. All these are evidence of what? Prostatic diseases. Once you start having that pain, when you ejaculate, that means you could be having prostatitis and not cancer of the prostate, please. Then, of course, erectile dysfunction. Many of us at our age, sorry, I have to be very vulgar here. We have passed the era of deeper, harder, deeper, harder, deeper, harder, please. Whatever you can do it and leave it there. Because that prostate is also doing what? You are also overworking it. Please take note. Then, of course, these are some of the things, prevalence of it. I just brought out these statistics for us to see that if you look down, the prostate cancer is coming up because of racial factors and because of other factors we have mentioned earlier. Then the lateral hypertrophy is also going up, especially in Nigeria, looking at our population and so on. So it's becoming an emerging concern among Nigerians that once you go for PSA and it's found to be high, you're already thinking that you have cancer of the prostate, which may not be true. The key messages about PSA here is one elevated number is not equal to cancer diagnosis. What does that mean? If you go to a hospital and they tell you that your PSA is 100, for God's sake, try another hospital. Try the third, because it may have to do with what? The equipment you are dealing with there, or what they call inter-observer error, resulting from the lab scientist. So you must do this serially for you to be able to know that, okay, there has been a series of elevation. If you do it this week, you can repeat it in 2 weeks. If there's an elevation, in the next 6 weeks, then you now start trying to look at it. So think of a PSA as a smoke detector. You enter this room, then suddenly observe that there is a smoke detector here, and there's little smoke that came out of it. And all of us here jumped out of the place. Nobody has ever bothered to come back to find out what it is. It could just be something that has snapped a bit. So we must be very, very careful not to blow up the roof, because we have seen that there is a little smoke resulting from the detector. Please take note. I brought this out so that let us have an idea of what the levels is. In several hospitals, they will tell you that the range is usually 0 to 4. That's what they said. But don't forget that this is age dependent. So for somebody who is 40 to 49, 45-year-old, for example, if he has that 0 to 2.5 nanograms per milliliter, it's said to be normal. For somebody whose age is 50 to 59, he has it up to 3.5, it's still normal. Somebody whose own is 60 to 69 is coming up to 4.5, which has gone 0.5 above the level. Consider his age. Then somebody who is 70 to 79 is having 6.9 nanogram per milliliter. These are ranges. They are not values that somebody will just say, a 65-year-old Hussein who is standing before you, then you now say, my PSA is 5. Then you now come back to tell me that it is abnormal. Let us take note of this. These are just range of values that you can get. But wherever you get to, they will tell you it's 0 to 4. All of you believe, we are all scientists, that you cannot have 0 to 4 as a concrete wherever you are. There's what they call free versus total PSA. You know, I did mention that the protein itself that we are measuring, the free ones is the one that leaks into the blood that we have measured. It is that, what do you call it, that quantity that is there that determines whether the person is going to have cancer or not. Then apart from that, what about PSA velocity? That means at what rate is it increasing? Those are the factors that we need to take into consideration when we are talking about PSA. At the same time, if you over-detect and you over-treat, you are giving the same person a problem. Because the side effects of the chemotherapy itself can be very, very, destructive. So please take note. False positive result. For every 3 men that are tested, it's assumed that max, even for those that have been biopsied, only 2 out of 3 will come out with a cancerous situation. So meaning that we do not just take it with a pinch of salt that once you have it, then of course. Then what does that lead to? Unnecessary anxiety and stress. 2, follow-up MRI. The doctor will tell you, you have to go and do MRI so that for us to know what is happening. And MRI is 250,000. So it's beginning to show the cost you are going to face. And then small but real risk is what? Bleeding and infection. If they go to do biopsy for you, once they do the biopsy, they have introduced an instrument into you. You bleed for some time. And the bleeding can also lead to infection. Then, of course, cost and time wasting. You have become the customer of the doctor. Every time he gives you an appointment, come back in 2 weeks, and you do that. False negative here. I talk about false positive first. False negative here is that some aggressive cancers do not raise PSA significantly. The level is just there. You may not know. That's where the issue now comes in. But a normal PSA lowers probability that you may not have cancer, but it does not eliminate it. 2, aggressive tumor type can produce little PSA. Then finally, what is most important for you is, as a patient, is once you have persistent urinary symptoms that is persistent, please follow up a PSA and make sure that it is not caused by either prostatitis or the cancerous situation. Cancer is like, there are two modes of it. I showed you the benign prostatitis hyperplasia, which is like the turtle type. It's slow growing. It may not cause any problem, but the fact is that over time, it may cause. And it's usually not easily detected. Then the other one is the tiger aggressive type, which is the one that with a little PSA, before you know it, the damage is already ongoing. And in some cases, before you know it, they will tell you, this person had prostate cancer stage 3 or 4, because he may have been doing the PSA, but he did not show any high level. The clinical challenge that we are putting across to all of you is that who always tell which one is the turtle cancer or which one is the tiger cancer in terms of propensity, in terms of virulence in this situation. This is what you as the patient must be on the lookout for. Why? Based on the symptoms I earlier mentioned. If the symptoms start, becoming too frequent, then you know that something is going on there. But if the symptoms abate as a result of maybe antibiotics that you have taken, then you know that it could be due to prostatitis, which has been cured. When you treat cancer, there are why overtreatment is a real cost. The moment you pronounce yourself as having cancer, what happens? Urinary incontinence will come in. Why? Because they have put in a catheter into your bladder. And that catheter has also widened the urethra. And once the catheter is out of it, the next thing, when you sit down, urine will be dribbling from you. Why? Because the catheter is there. Now, someone removing the catheter will make it something that is done slowly. Then erectile dysfunction. They have also gone into touch that. I told you earlier that the prostate also produces protein alongside with the seminal vesicle that will make spermatozoa activities be active. After surgery or radiation, it will be reduced. So your erectile function will also be. Then bowel changes. Also, somebody who has seated to be having normal diarrhea will now be having either constipation or having continuous diarrhea. So what are the guidelines? I picked two groups of people, the public health experts and the urologists. For the public health expert opinion regarding PSA, what it says is that the individual should take his own decision. Having seen the physician, then he should be followed up, depending on how he wants it and how the symptoms appear to him. The urologist, that's the man who has to bring out the knife to do the thing, will always agitate that once there's a prostate somewhere and it is, enlarged, remove it. So that depends on schools of thought. But the message there is that there is no universal right answer here, because that urologist, before he does anything, will have done a rectal examination to look at the extent of the prostate. If it has effect on other organs, he may have his, but if he does not have, and you decide to go ahead and do the surgery at that time, you'll be facing these conditions I've mentioned. These are all complications that could come with the surgery. Then, of course, let me just quickly be rounding up. The average risk is this: at 50, please try and do your PSA. Higher risk for families, if you have a family history of cancer of the prostate, please start having a conversation with this thing, PSA, from the age of 40 to 45. It is very important. But this is very personal too. And risk-based decision has to come from you. An elevator result, when you repeat the test, that's what I said. Confirm the result to rule out temporary causes. That's the first stage, after you have done the test severally. Then you do an MRI imaging. This is a non-invasive test, so that they will tell you what's the size of the prostate. What is the shape? Remember I mentioned that it's a walnut shape. The shape will change once there's an increment in it. Then the targeted biopsy will not be that. They will go straight to where the prostate is, having known the areas where the expansion is going, so that they reduce it from the level of that expansion without impinging on the urethra that is there. Then, of course, shared decision means whatever you are doing, please, as a patient, your doctor must tell you what he's doing. That's the problem we have in Nigeria. The surgeon will tell you, yes, you have a fibroid. We are going to operate you. That is not the issue. The communication must be there so that I'll be convinced that whatever is going to come out is something. Sorry, I'll have to tell you a little story. I went to a hospital in Abuja to see an 86-year-old man that was for surgery. And when they said it was for surgery, his son was also outside the country. So the son now called me and said, please, can you help me find out what is happening? We went to the hospital. I met the surgeon, and the surgeon said, we observed that the man has intestinal obstruction. We are going to open him up. Said, okay, you are opening up. What is your present finding? You know, when I started asking you some questions, I said, please, are you a doctor? And I said, yes. It was then he now cautioned himself and was not talking again like somebody who he was dealing with illiterates, with due respect to you, non-medical persons. So he now said, okay, this surgery that I'm going in for, could there be complications? He said, how? I said, okay, if you're going into this patient and you discover that the intestine there's a blockage somewhere, which you know what they call end-to-end anastomosis, and you cannot do it now, will you bring out that intestine outside for the person to be passing through there temporarily? It's called colostomy. He said it is possible. I said, did you explain this to the patient? You understand? He said, no, he has not. Then I now asked him again that this patient, you wrote there that the patient is coughing. If this patient is operated, and at the end of the day, he starts coughing. Can he have what they call burst abdomen? He said he did not say so. I said, please document all that. And I now told him that after the surgery, I want to see the what they call it, the post-op procedure. Of course, the old man who was there till today kept asking me, he saying, thank you very much. That even when they were in the theater and they were operating, that he was hearing them saying, look, I do a model, no say that man there outside. Meaning that if there was nobody policing them, I'm just trying to bring this out to you. That's what happens in some cases. Sorry, I'm taking you out. So, for a doctor, even you as a patient, many of you go for ultrasound, and when the man is doing it, he's just putting the probe on your tummy, and you've not had the, what do you call it, the bonus to say, please, can you just run a commentary on what you are doing? You have the right to do that. You have paid him. Run a commentary so that the man will tell you, this is where your spleen is, this is where your stomach is, this is where your liver is. The liver appears enlarged, and so on. You'll be seeing it yourself on the TV screen. Any doctor, any sonologist that is not running a commentary or doing EMR for MRI and is not telling you, please find out. You should be saying it, please. Then, of course, take home message here. Know your number and the limit based on your age. 2, prioritize your conversation over the number with the physician. 3, manage the patient like any other risk. Don't see it as if I have a PSA, then God, that is the end. Lord, I'm coming home. It is not true. Manage it the way you want it. Then you invest in the fundamentals. What does that mean? There are other things that we tend to, or we don't do. Weight reduction. Exercise. Diet. I won't say it here. At our age now, anybody that is that relies so much on animal protein is just wasting his time. Sorry, with due respect to all of us. Say this, which might be the last, before we talk. It's a useful clue for you, PSA, but not a verdict. It's a clue, it's not a verdict. Please take note. Then, of course, know your numbers I've mentioned. Screening is a personal thing and risk-based decision. And elevated results starts a conversation, not a diagnosis. Please take note. I just brought this out for us to know that we have retired, we have come of age, and at our level, it is not cancer of the prostate that is our problem too. All these are our problems. Hypertension, diabetes, other cardiovascular diseases, chronic kidney diseases, and so on. So what we do is we must make sure that we tackle this alongside the PSA. How do we do that? We remove stress in our lives. Honestly, I tell Colonel Adebi is my very close friend. What did I normally tell him? I say, I don't put people's problem on my head. I put it on the shoulder so that when it becomes too heavy, I will just bend my shoulder and the problem will fall off and I will move on. Now look at what stress is. You have gone through a lot in your various places. What you have here is eustress. Eustress is profitable stress. See how it goes. For each of these, you have a lot of performance. There is a reward for it. In the army, you rose to the rank of Major General because you are working for it. And that is eustress, because there are some stress that you will have gone through at that time. But there's now a level of distress as a retiree when you start carrying people's problems on your head and see how it becomes. Negative things, and when it gets to the end, what will happen to you? You see, brain reset. You're already down because of what? Other people's problem. So what do you do first? Remove stress out of it. Whatever you can do with yourself, do it now. You don't need to satisfy anybody. Sorry, I'm going out of my lecture. Then, of course, medical test, very important. Do your test regularly. I always say it that at the end of, for those of you who are in the Navy, for every birthday, you go straight to that place and you do a comprehensive medical test. If you don't do it, they won't fill out your performance evaluation report. In other climes too, that's what they do. At least on your birthday or on your year of, a part of your, when you go for crossover on that day, tell God that I will do my annual medical test at the beginning of this year. I keep asking people, sorry, I will take your time. Peter Arrow is here. If I ask him how many vehicles he has, he may tell you he has up to 3 or 4. And if I ask him, how many of them have you serviced this year? He will tell you that virtually all of them have been serviced this year. But these are vehicles that is carrying him all over. Now, let me ask him, have you serviced yourself this year? Have you done a comprehensive medical test this year? It may not be, because we are worried about the vehicle breaking down to make us be seen on the road. But we are forgetting about ourselves that will break down if we don't have a comprehensive medical test. And next, I just want to show you this. These are the tests that you can do. Regular blood pressure, free. Full blood count, you know what it is. If your blood level is not high enough, you might be feeling dizzy when the hemoglobin level is low. I'm sure Connor Debbie is here to say, serum electrolyte, your body needs sodium, potassium, for it to balance, and chloride to balance up your blood pressure. Urea there is also very important. Creatinine tells you about your kidney functions. These are simple tests. Lipid profile, if you are hypertensive or you are diabetic and you are on those medications, every 6 months, you must do your lipid profile and what? Liver function test. Because if you don't do it, it will get to a time that when you go for abdominopelvic ultrasound, they will tell you that you have a fatty liver as a result of that. And when you put all these tests together, I have gone to check Sign Lab, DHQ Medical Center. Those of us that go as civilians in Naoa, max 135,000 in a year. Divide it into 12. How much is it? So if you contribute that every month, that's roughly 11,000 per month. Possibly that's the amount that less than what you spend in servicing your vehicles in a year. So please, let us go back. These things we can easily do, please. Tips to prevent cancer itself. Limit alcohol intake, maintain healthy weight. At retirement, you must be doing something that will make your weight to remain, rather than adding additional weight. Get involved in exercise, your diet. High-fat diet will increase the risk of disease. Things like soya beans and so on. Then fish, salmon is also very important. Many of you take vitamin E like that. That thing that looks like oil is called liver oil. And that cod liver is what? It's a fish that you are getting the thing from. So it's good for you to take that. Some of us may resort to this at this age, believing that native medication will help. I am not sure. The reason is that you don't know the constituent that is helping you out of the whole lot. So you must be very, very careful. And these 3 organs are affected: the heart, the lungs, and the spleen. And the kidneys. So we must be very careful with this. So try to avoid some of these herbal products. On a lighter mood, somewhere around the area too there, my driver saw people that were selling this, these fruits and so on. I had gone out, he now bought. I don't know what he wanted to buy, whether it is aphrodisiac, that means to enhance his performance. And when he got home, he took it. Day 1, I didn't see him. Day 2, day 3, I now called the son. I said, what is happening to your father? He said, my father had diarrhea since 4 days ago. He kept going because of what he took. You understand? So some of these things have their own adverse effect. Please, I want you to look at this picture. When we were in NMS 15 years ago, we were like this. What happened is that for every activity that is happening in a company, it's going to be a group activity. Even when you are dodging, you're already telling your colleagues. So we were living a polygamous, very communal life. Let me tell you one interesting thing about me when I was in Form 1. Many of you did not know. While all of you were running to Angwam Maigodo to dodge, or you go to permanent staff quarters, do you know why I was dodging? Just before you enter depot, there's a cemetery by the side. You understand? That cemetery was where I used to go quietly. Myself and late, if you know Liadi Lawal, Rigali Lawal. We'll go there and stay there. Nobody ever bothered to come look for us. And when it is evening, we stroll back into that place. And I think a group, Muritala, Idi Amadu, and Najimu, later also got to know about the trick. I won't say much about their own exploits, but that was what we were doing then. Now, what I'm saying in essence is that we must cultivate that habit right now so that we should be together. A company, I know there are 6 companies. I just decided to match 2. B company, C company, D company, E and F company. Be calling yourself. Have a very strong, WhatsApp platform. If you don't hear from somebody within 2 weeks, call him. Oh boy, how are you? We just want to find out how you are. And make sure that you move along. Don't forget what the Bible says. Godliness and contentment is a great gain. And don't also forget that the spirit of cohesion is what brings them. And finally, don't forget the same Bible says, wherever you are, be at peace with all men. This is the time for you to make sure that you do the right thing for all of you so that you remain together. Thank you very much. I'm grateful.
Can we please have another sounding round of applause for that short but very impactful session? Thank you very much, sir. Members of NMS 1976, all other ex-boys here present, invited guests, ladies and gentlemen. The next item on the program is the presentation of gift. And to make the presentation, may I most respectfully invite ex-boy Didi Amadou to make the gift presentation. The president, sir.
Good afternoon, ladies and gentlemen. I know we have ladies who are not ex-boys, of course. But we also know that in some towns, we have ex-boys who are women. Are you aware? Okay, that's my own secret. Well, ladies and gentlemen, I think we need to take questions from some of us. This is a presentation that sometimes makes everybody scary. You know, everybody is very sober. You can take any lecture on anything, but when it comes to medical lectures, we are almost always sober. So please, can we, for clarifications on the presentation? Yes, sir. Listen.
So mine is a very simple one. You mentioned something about bicycle riding. So what is your, because I'm in that group.
PSA test, they call it, and every time they give me a negative, they just say negative. But you have emphasized numbers here. And when you take this negative to the doctor, he just looks at it and say, okay, what's the meaning of that? As a doctor, if I come to you with a negative result, what does that mean? Thank you.
Okay, please, gentlemen, can we let him go through the first 2 questions? Okay, so that they don't get lost. Thank you very much. Let me start with the first question, sir. Most times, we ride bicycle exercise. But in the process of riding the bicycle, is the perineal muscles that are very close to the prostate. They also squeeze, and when they squeeze, they compress on the prostate to release that protein which you are measuring. What you are saying in essence is that even when your PSA is high and you are a very strong, dedicated bicycle rider, know that the high level of it is coming from an activity, so that you do not just forget that activity. And I believe that the PSA level is due to any other disease condition. That's why I brought it out for people to see. Even when you have a trauma to that same perineal area, and it affects the prostate, you could still have an additional discharge. Don't forget, we said what they are measuring is just a little out of it that strays into the blood. The chunk of it is still there that goes with the seminal vesicles into the semen. So I don't know if I've answered your question, sir. Yes, sir. So the fact that you ride bicycle, please keep riding your bicycle. But when the PSA level is high, don't assume that it is due to an illness. It's due to your own activity. Then secondly, please, if you go for PSA and somebody tells you that the result is negative, please ask the person. Go back to the lab. I'm sure Colonel Adebi is here. It must have a number. If it is negative or positive, I'm here to see that. It must give you a number, because the number is what we are looking at for you to be able to make a range. And I told you that most places, they tell you is 0 to 4. But I'm giving you the range now based on age differentiation. Thank you very much.
Okay, sorry, gentlemen, let's go clockwise, okay? Let's go clockwise. Aro, please. Oh, 2 more? Okay.
Thank you, sir, for the well-researched presentation. Sir, I respectfully want to ask a question. When is it appropriate to do the ultrasound scan, even though you do your PSC? When should you do that? Thank you.
Ultrasound. Last one. Is something that you need to be doing regularly, be it annual, because ultrasound does not have radiation. You are not absorbing any radiation. Especially if you are hypertensive and you are diabetic and you are on all those medications, amlodipine, lysine,